Hello everyone, welcome to my channel. I hope you all are fine and healthy. In previous video, I shared the basic details of spirometry test. Like what is spirometry, when you should require the spirometry, who can perform the spirometry, and what about the cost of spirometry in India. And at last, I shared my experience while performing spirometry. But in this video, I will share how does spirometry work. For the spirometry test, we need a machine called spirometer. It is a medical device that consists of a mouthpiece and it connects to a computerized machine that measures your airflow. How do you prepare for the spirometry test? So before going to the spirometry test, you have to prepare by yourself by following some basic points. First of all, you have to stop taking whichever inhaler you are consuming for a short period of time. For the test, you have to wear a comfortable loose clothing that doesn't squeeze your chest. And you have to avoid taking a large meal at least 2 hours before the test. And you also have to avoid the heavy exercising at least 30 minutes before the test. You follow these 4 rules, so you are ready for the spirometry test. Next point is what all are the process of spirometry test. So before going into the process of spirometry test, I will show you something which is required for the test. So first one is the nose clip, which cover your nose. Second one is you have to use a clean and unused mouthpiece for the test. Before beginning the test, we have to fill the patient details, and in the details form we have to put the correct things only, because the test result influenced by some factor like age, gender, height, weight and ethnicity. So if you put in these things wrong, so the report may come in the wrong way. Before beginning the test, we have to explain the full process to the patient, and we have to tell the patient to practice 2 or 3 times, so make it the best result. So your healthcare provider puts a nose clip on your nose and then they attach a clean and unused mouthpiece to the device. After that, they instruct you to breathe out. After breathing out, you have to put the mouthpiece which is connected to the device and you have to take the deep air. After taking the deep air, they will say to breathe out forcefully. And again you have to take the deep breath. You will repeat the test at least 3 times to ensure your results are acceptable. Next step is you have to take the bronchodilator that helps you to open your airway. Then you have to wait for 15 minutes. Again you will perform spirometry test. Afterwards, your doctor will compare the results of your test before and after you inhale the medicine. Then they will decide you have to use the inhaler in your treatment or not. Now, I will add a clip of spirometry test for better understanding. Alright everyone, I hope you all understood the basics I covered today. If you found this helpful, don't forget to like, comment and subscribe for more content like this. Until take care, see you soon.